understand the following information will be gathered and utilized for educational purposes by Indiana Wesleyan student. I give my permission for this information for gathering and physical assessment to be filmed and posted on Blackboard for access by faculty and students of Indiana Wesleyan. The video will be deleted by the student as soon as it is reviewed and graded. I further acknowledge that this is for educational purposes only. The information is not meant to be diagnostic. Therefore, Indiana Wesleyan, the faculty, staff, as well as the student are not considered liable. Come in.
Hi, Miss Finley.
Yes.
Hi, I'm Jennifer. I'm going to
Hi.
be your postpartum nurse today. How are you?
Good. How are you?
Good. Is it a good time for me to go ahead and do an assessment on you this morning?
That's fine.
Perfect. Let me wash my hands.
Okay.
All right. How are you feeling this morning?
Good.
Excellent. So it looks like the student nurse was in to do your vital signs.
Mm-hmm.
She said your blood pressure was 114/72. Your heart rate is 84. Your respirations were 18. And your temperature was 98.7.
Okay.
So it looks pretty good. How would you rate your pain right now on a scale of 1 to 10? 10 being the worst pain.
It's about 7.
Okay, and where are you having your pain at?
Right on my incision.
Okay. Are you having any cramping at all?
Yes, when my daughter is breastfeeding.
Okay, that's pretty normal
Okay.
to have cramping with the breastfeeding. It's helped contracting your uterus down.
Okay.
It also helps control your bleeding, which is
Okay.
good. Stimulates that natural oxytocin. So they do have naproxen ordered for your cramping.
Mm-hmm.
And you can take that at once every 12 hours, and it looks like you're about due for that. And then you are due for Vicodin as well. It looks like it's been about 4 hours. Would you like 1 or 2?
I'll take 1 to start out with and see how I handle it.
Okay, excellent. So it looks like you are about 24 hours postpartum,
Mm-hmm.
and you had a C-section yesterday.
Mm-hmm.
Is this your first C-section?
It's my 3rd.
Your third, okay.
I have a 13-year-old and a 10-year-old at home.
Okay.
2 boys.
Oh, so you're busy.
Yes.
They're going to be big helpers, I think.
I hope so.
Excellent. So, in your medical history, do you have any other history significant?
Hypothyroidism.
Okay.
And I've had postpartum depression.
Okay.
And I have had numerous kidney stones.
Okay. For the hypothyroidism, do you take anything for that?
Synthroid.
Okay. We'll go ahead. Have you had that since you've been in the hospital?
No, I haven't.
Okay. So we'll work on getting that
Okay.
ordered. And then the postpartum depression, did you have that with both your previous pregnancies or just
No,
one?
it was just 1. It was the first one.
Okay, and when did the symptoms start?
A couple weeks after we left the hospital.
And what
I
were
just got emotional and just overwhelmed, and mood swings were back and forth. So I thought I'd go to the doctor and determine I had postpartum depression.
Okay. And what did you take any medication for that?
Prozac.
You did. Okay.
Mhm.
Well, it sounds like you know the signs and symptoms. If you start getting tearful, if you feel like you are going to harm yourself or the baby, or you just get really emotional or having those mood swings, anxiety, any of those, please let us know.
Okay.
They often don't start in the hospital, but they certainly do a few weeks after you leave the hospital. So be sure to talk with your husband, your healthcare provider. But most importantly, if you feel like you're going to hurt yourself or the baby, definitely call someone as soon as possible. And we'll go through some education with your husband, just so he's educated as well, because oftentimes the husband will identify the postpartum depression first.
Okay.
Okay?
Mhm.
Let's go ahead and check your breath sounds and do your assessment.
Okay.
Okay. Have you take some nice deep breaths.
Okay.
Okay. Just go back here. Excellent. I'm going to go ahead and have you lay back, if that's okay.
Okay.
So the night nurse said she got your Foley catheter this morning.
Mm-hmm.
Have you been able to get up and go to the bathroom?
Yes, I have twice.
Okay, and how did that go? How did you feel?
It felt like I was having trouble getting the stream going, but
Okay.
once I was able to, then
Okay.
it was a little bit better, and I was a little wobbly on my feet, so it just made me a little, I think, just overall nervous about everything.
Okay, so we're going to go ahead and make sure that you call for assistance the next
Okay.
time you go, just so we make sure that you're steady on your feet.
Okay.
Sound like a plan? Mm-hmm. Let's go ahead and check your bowel sounds.
Okay.
When was the last time that you had a BM?
Day before I came to the hospital.
Okay, and have you been able to pass gas since you've delivered?
Yes, I have.
Excellent. Well, it sounds like you've got good bowel sounds. Have you been able to eat anything since delivery?
Clear liquids.
Okay. Well, since you're passing gas, we can go ahead and start you on maybe some toast or some applesauce this morning.
Okay.
See how you do with that, and then we can progress throughout the day.
Okay.
Okay? Let's go ahead and take a peek at your incision.
Okay.
It looks like they've put steri strips on there,
Mm-hmm.
and they have a suture.
Mm-hmm.
So the steri strips over the next few weeks will fall off, and the suture they'll probably remove before you leave the hospital.
Okay.
Just make sure to keep that nice and dry, over the next several weeks for that incision to heal. If you experience any burning, any pain that you haven't been experiencing, or if it starts gaping open, you definitely want to make sure to call the doctor.
Okay.
So make sure to look at that in the mirror when you are able to shower.
Okay.
Let's go ahead and check your fundus, your uterus. It's nice and firm.
Okay.
And it's right at the umbilicus where we want it. Looks like you have a minimal amount of bleeding.
Okay.
Leukia, which is normal. Let's go ahead and check your legs for swelling.
Okay.
Looks like you have about +1
Okay.
edema, so it looks like you have some swelling. Did you have swelling prior to delivery?
Yes, I did.
You did.
Mm-hmm.
Did you have any blood pressure issues?
Nope.
No headaches that were associated with that?
Nope.
Excellent. Are you having any headaches today?
Mm-mm.
Okay. Push your foot back. Do you have any pain in your calf when I do that?
Nope.
Okay. This one?
Nope.
Okay. Excellent. Well, it looks like your assessment is good. We'll go ahead and get you some breakfast, and we will go ahead and get you your pain medicine.
Okay.
And is there anything else this morning that I can help you with, or?
We are Catholic, so we would like to have the baby blessed
Okay.
before we leave, and the chaplain's fine here to do it.
Okay, we'll make sure that the chaplain comes in to do that, especially when your husband's here.
Okay. Yes, please.
And then, are you planning on breastfeeding?
I am.
You are. How is that going for you?
She's having trouble latching on a little bit, and it's kind of painful.
Okay.
It just feels like she's tearing my boob off, so it's,
Okay.
yeah, so I think I may have like a crack or something, maybe.
Okay, so let me take a little
Okay.
peek if that's okay.
Yeah, that's fine.
And, looks like you're starting to feel just a little bit. Sometimes that happens a little sooner with your second or third baby.
Okay.
You do have a nice big crack
Okay.
on your right side, along with a little bruising.
Okay.
So I'll get you some hydrogel dressings that will
Okay.
help kind of heal that portion up. And then for the other side, maybe we can do a little lanolin,
Okay.
which will help with a little bit of that cracking and dryness. So
Okay.
it'll help keep your breast nice and moisturized. And then for feedings today, just call myself or call lactation.
Okay.
And we'll come in and help you with the feeding and work on the latch just to make sure we get a bigger, deeper latch for the baby.
Okay.
Okay?
Okay, that's good.
Any questions or concerns that I can answer for you?
No.
Okay, well, I will run and grab your pain medication,
Okay.
and we'll get you some breakfast ordered. And if you need anything today throughout the day, just don't hesitate to call.
Okay.
Okay, nice meeting you.
Nice meeting you.